Good evening and welcome to First Issues. Petrol station attendants working at busy garages across the country could be working themselves to death. Although First Issues was unable to gather information about the risks that petrol attendants face in the execution of their day-to-day jobs locally, research gathered from petrol stations in South Africa reveals that petrol pump attendants are at a far greater risk of damage to their DNA through benzene exposure than those who are not exposed to the same contamination during their daily work. The regular inhalation of fumes in close proximity to petrol tanks and pumps is seen as the main contributor to the DNA immune damage. In South Africa, the regulated exposure limit for chemicals such as benzene is 16 milligrams for an average 8-hour shift, which is more than 200% than that allowed by the Occupational Safety and Health Administration in the United States. The same applies to European countries. Efforts by First Issues to establish the Botswana permissible standards hit a brick wall. Our interactions with various petrol attendants reveal that most attendants have no idea that their job is potentially dangerous. And those that have an idea have no appreciation of the magnitude of the problem. Our first commentators work at local filling stations, and they told First Issues that they have never been tested for any poisoning resulting from petrol exposure, and say no one has ever told them that their health could suffer. While occupational exposure to petrol is generally considered unhealthy, and benzene is known to have a serious health impact on human health, there seems to be very little interest from researchers on this matter or sufficient information by the petrol attendants.
bothata ba go hupela yana more especially mong kwa teng go sa ma o sa utlwanehela le wena o sa tsamaisane le wena o se tlhela re ga go rata
ke akanya gore diphatsa ba petrol e ka nna dio tshwana mo ka nna ngombo asthma.
It is with these concerns in mind that First Issues decided to focus on this subject tonight. And to help us discuss the matter in depth, we have an Environmental Health and Safety Officer, the Managing Director of Vivo Energy Botswana, as well as a medical professional. Thank you for tuning into the program. Enjoy the show. Welcome back to First Issues as we look to see how well the health and safety of petrol attendants is being protected at their various workplaces. We have been asking all our interviewees what health risks they assume are associated with their various professions. But now think it best to consult medical professional Dr. Kiran Bhagat.
Petrol is a hydrocarbon. It comes from the ground. There's no natural petrol. It's actually extracted from hydrocarbons under the earth. And so the petroleum industry coined the word petrol, which is a distillation of some of the hydrocarbons which we use for fuel, as you know. And the common use of petrol is in the car industry, is in the automobile industry. Because it's a hydrocarbon, it is toxic. It is flammable, as you know. You can light a match and you can blow up. But in terms of the direct effects, one can imagine simply the sort of the routes that it follows from the nose down into the windpipe and then into the lungs, and sometimes by mistake you can actually swallow it. So if we just deal with those issues on a regular basis, those particularly in the petroleum industry, we talk about simple people like petrol attendants, are constantly inhaling the substance, wantonly or unwantonly. So no protection is there. So one has to ask, what are the effects? Well, the immediate effects are if you're touching petrol, you may be allergic to it, you may have skin reactions to it, you may get what we call eczema, which is a dryness and an itchiness of the skin. One always have to ask the petrol attendant, do you wash your hands after you've finished work at the end of the day? Are you getting rashes? And of course, the petrol attendant, as he's emptying fuel into your car, is inhaling some of those fumes, because those fumes are automatically dissolve into the atmosphere, as you know. You can actually smell it when you're sitting there in your car waiting for the tank to be filled up. You can imagine a petrol attendant 8 or 9 hours of the day inhaling the substance sitting at the petrol pump. The effects are immediate, and they can affect the nose and result in nasal congestion, which means your nose gets stuffy. You can get conjunctivitis and irritation of the eyes because the petrol stings the eyes. And of course, if you're inhaling it and you have underlying lung disease already, or you may not even be aware that you have lung disease, say for example that you are a mild asthmatic, and you suddenly get a job as a petrol attendant and you start coughing. Cough often is the first sign of asthma. So you may start coughing, or at night you might wheeze. These are the signs that the petroleum is getting into your lungs and causing what we call bronchoconstriction, which means a tightening of the lung airways. So these are some of the regular features we see in petrol attendants that come in and complain of cough, complain of frequent sore throats, because it's what we call a chemically induced irritation of the lung fields. If by mistake the petrol attendant or somebody dealing with petrol on a regular basis ingests the petroleum, that can result in nausea, in vomiting, in an incredible stomach upset. Gone are the days where we have lead petroleum, and as you know now we have unleaded petrol, and one of the reasons was that lead was immediately toxic. And we know that if you inhale certain types of petrol, you can get what's called a chemical pneumonitis, which means a pneumonia induced by chemicals. So those really are the regular things that one needs to look out for when regularly exposed to petrol or petroleum products, because they're all, if you like, the mother of all of them are the hydrocarbons, and then you've got all these little cousins and aunties, such as paraffin, such as petrol, such as diesel, liquid petroleum gas. They're all much the same, and they all cause the same thing. So those out there that deal with the petroleum industry on a regular basis need to make sure they have regular checkups, both in terms of allergies and in terms of lung function testing, and of course to make sure that they're not having any gastric issues as a result of regular swallowing of some of this petroleum.
How frequently then does Dr. Bagas suggest that petrol attendants go for medical checkups?
Depends. If you're on a contract basis and your contract is short term, the effects of temporary inhalation are not major, and there's no major published studies that show that a brief stint at a particular garage is going to do you any harm. But if you are on a long-term contract, I would say at least on an annual basis, you must make sure that you have a general checkup where the doctor or the facility that you're going to listens to your lungs, asks you the questions about skin problems, eye problems, frequent sinus congestion or headaches, because often these are taken for granted, and the poor petrol attendant simply assumes that he's tired and he's got a headache, or he has allergies and it's flu, when it actually may be a chemically induced issue. And I think that awareness simply makes them more conscientious about preventive measures.
Joining the conversation is the Managing Director of Vivo Energy Botswana, Wayne Kingwell. He says although the international standards the company follows prescribe regular medical checkups for certain roles within their operations, no such need has been determined for petrol attendants.
What the guys are taught in the service station environment is that the fumes themselves, carry risk with them. Obviously, it's a very open environment, so the fumes dissipate very quickly. Generally speaking, the site staff are not directly exposed to the fumes. What we do is when you fill the tanks, there's fumes associated with that, but then what we do is we put cones around, barriers. Part of the quality marshal's role is to keep people away from that area. And as I say, there's very limited fumes when the guys are filling the vehicle, and it is in an open space. But what we do is we do make sure that people are very aware, and also to make sure that if there's a high concentration of fumes, that they avoid that. So in terms of the risk in this environment, it's very small because, as I say, it's open air, the fumes dissipate very quickly. What is probably much higher risk is when you're in a confined space, and then that's when we take even greater precautions. So as an example, if I'm repairing a tank and I need somebody to work over the tank or within a confined space where there's a high incident, then we take extra precautions, and that's what we call PPE, which is the the right safety gear that you wear in terms of face mask, etc., because there's a higher incidence of fumes. For the Shell or the Viva Energy staff, particularly, there's certain roles which are identified where a health checkup, so basically what we call is like a baseline study. So we continually do those. So that will be like in a depot environment. So where we store our fuel. So we just do make sure regularly that we do check people's health, just to make sure that that they there's no change in their health from the time that they start with us and throughout the employ.
Does our medical expert concur? Do petrol attendants face little to no risk working in petrol fumes?
Well, my comment to that is an immediate comment to say what their definition of harm is. If you have a rash, is that harmful? If you have a mild cough, is that harmful? Perhaps they're talking about significant harm which requires hospital admission, which requires intravenous antibiotics, which requires regular long-term use of inhalers for asthma. Where does one draw the line in terms of occupational hazard? So my answer to that would be, what evidence is there that they're not doing any harm? And where are the published studies? There are many published studies that show that petrol attendants do suffer from lung complications and skin allergies and conjunctivitis, and one just needs to be aware of that. That may not necessarily require hospital admission or regular treatment, but the petrol attendants or those that in that industry need to be educated in terms of the occupational hazard.
Welcome back to First Issues. As in this final segment of the show, we speak to a representative from one of the many government departments responsible for implementing good workplace practices. We found that even at this level, there is need for the refinement of policy to better govern and standardize occupational health and safety standards.
Ke batla go papamatsa hela kere melao e teng e leng gore gongwe kgang eo e ka thusa go e rarabolola, mme hela bothata jo bo leng teng ke gore melao e kgaogane o itlhele e mengwe e le ko molaong o mongwe e le ko molaong o le kwa bora ga le bereka ga re le bereke ka melao e kgaogane mme yone hale e teng. Melao e tshwanang le bo Factories Act e teng, melao e tshwanang le Public Health Act e teng, melao e tshwanang le bo Building Control Act e teng. Jaaka ga nne ke tlhalosa gore ha planetla re lebella gore tse ya go nnang dirai ke eng mo go se setlaveng sa agiwa go itlhelele nako e setlaveng se dirisiwa, mme ha re lebella re dirisa yone melao e ke ntseng ke e balolola. Jaanong ka go rialo batho ba gwebang ba bagwebi le bone ra be re ba tlhaloseditse ka melao e ha ba simolola emma gore dikgang tse ba tshwantseng ba di ele tlhoko ke.
In which ways does our guest think the refining of policy could improve the enforcement of good workplace practices?
Tota mo molao o tlhamaletseng o itebagantseng le dikgang tseo tsa botsogo jwa setšhaba le bone badiri o ka tlhouhatsa tiro ka gore jaanong o tla bo tlhamaletse ebile go sena makgwere ape. Ha ke ra motho ke re se ga wa se tsenya ke a be ke bua yaanong ke tlhamaletse ka gore le nako ha simolla re ne re tla bone re tlhamaletse gore o tshwanetse o bese ka tshetlanae, o tshwanetse o bese ka tshetlanae. Yaanong go nna motlhou ka gore motho le ene hela ka boyene o kgona gore le ene a ipharologanye kgotsa a ipapise le sone seemo seo ha a simolola gore a mme ke dira sentle ka tshetlanae kore le ene o kgona gore a itirise a ipeye mo diemong tse. Yaanong mathata ha go bukilwe le ene o kgona gore a dire sengwe mme kante o tlogetse sengwe se e leng gore nna ha ke tsena jaanong ke eta ke re mme se gore a re ga se tsamayane le kgang e re e buang emma so ke gone hela ka ha e leng gore ke tsaya gore go ka re thusa ka teng re sa goboka.
Even with these stated challenges to the clear delineation of health and safety standards, Mr. Mataila says those who do put the health and safety of their workers at risk can be taken to task.
Dikgato tse di ka tseelwang ba leng gore ke ba dikgwebo kana bone ba leng gore ba tla ba ba tlola gongwe ditshetlana dingwe tse di rileng tsa go sireletsa setšhaba le babereki. Di ka nna go ka tswa ka gore tota mme molato ke eng kgotsa se re se tshwaileng le gore ke phoso kgotsa ke go lebalesega mo ditsamaisong tse ba di dirileng e ka tswa e le go na le gore motho re ka moha malatsi mo re mora re mo nakong e kana bankanya seemo sa go nna jang, mme ha motho a go nna jalo a sa kgone kgotsa a sa diragatsa se re se kopileng gore a se dire mo nakong e re mmetseng. Yaanong ho kgato e re ka e tsang ke gore re ka kgona gore gongwe re motho a go nna yalo re a tlholwe e ka nna ka madi kgotsa motho a go nna yalo o ka tlholwa madi kgotsa a isiwa kgolegelong. Mme dilo tse gore di diragale ke gore e be le gore tsamaiso re setse morago ya go kopa gore gongwe re kopang mo go ba melao gore nya mme motho a go nna jaana o tlotse tsamaiso mme re batla gore a dire tsamaiso a go nna jaana, e be re kopa ka ha molaong gore gongwe motho a go nna yalo molao o mo kwalele o mo pateletse gore a dire jalo. Mme mo gongwe gape re kgona gore motho e be le gore lehelo la go nna yalo re kopa le one tsamaiso re sala tsamaiso o morago gore gongwe motho a go nna jalo o ka nama a tswetse a bankanye diemo tsotlhe tse e leng gore tla be re di mo lebisitse ka nako yone eo.
What are our guests' views as to the occupational health and safety standards and practices within this country?
No, I think generally there's a good dialogue. So I think there's a joint responsibility between, let's say, government and legislators and ourselves as the private sector. And I think particularly private sector entities that operate outside of Botswana. So as an example, in our case with Shell, they operate worldwide. They have 100,000 employees and they operate in many countries, many locations, many of which are more extreme environments than this. So that's what I'm saying. So what they've done is they've adopted a very high standard, which basically caters for all situations. Now I think potentially, where as I say, government departments, legislators could benefit is calling on the private sector for best practices that exist. And I mean, they may not adopt them verbatim, but what they could do is use them to get really good inputs to improve, just to improve the standards. Basically what we do is we tend to take the highest standard worldwide. So, I mean, as being part of the Shell family, Shell tends to oversubscribe. So in other words, what we tend to find is Shell standards are higher than most international standards for most countries. So what we will always do is we'll adopt the highest standard. So normally it's the Shell standard or our own standard, Viva Energy, because as I say, we're part of the Shell family as a licensee. But if there is a higher standard in the local legislation, we adopt that standard, obviously.
I think like many countries we are in a state of evolution, and I think that legislation needs to be firmer. I think that the process for change first occurs with education and awareness. And I think if we educate those employed in that industry, because they may have no option but to work in the concrete business or the petrol business or the mining business, pretty much like those that used to work in the tobacco fields in our neighboring countries, they had no option. But if they are aware that they're putting themselves in that danger, then it's an informed consent. I think too often our workers are left ignorant with the claim from the corporate industry that they have educated them. And when you actually look at what and how they've educated them, it's paltry. So I think that the legislation needs to have firmer, finer and sharper teeth, and knowledge equals power.
As we wind down this evening's conversations, we take note, and trust you will too, of the strong calls by some of our commentators for education to be the key to addressing this situation.
Gore re ratlegile ke gore batho ba nonohile mo kitsong bone ka bo bone gore ba ka itshireletsa jang. le bagwebi ke gore bagwebi le bone ba nonogile mo kitsong gore dikgwebo tsa bone di ka ama jang matshelo a batho mme ebile ba rotloetsa sone sa go nna jalo ka gore tota ga go thuse gore re be re ka bereka re le nosi ga go kgonagale re tlhokana le kitso ya batho le gantsi le ha e le gore ba na le kitso kana tota go batla tiro ke kgang e nngwe gape e masisi le sone seemo sa motho o sa itsholelo a leka go ipatlela se a se isang go ganong le ha ntse go na le dirai dingwe tse e leng gore wa ditse mme ka ntlha ya gore gongwe o tla ba batla phalitšhenyana go raya gore tota motho wa modimo o tla ba a bereka hela le ha ka re wa ikuela kgante le o tshaba le gone gore kana be ke tloga ke kubiwa jaanong ke tsone mathata a leng gore re na le one a e leng gore a re buisetsa ko morago.
Commenting on the issue of petrol fumes poisoning, a commentator based in South Africa, Liz Clark, said there are several possible solutions to minimize overexposure to fuel fumes by petrol attendants. Maybe one of those is for there to be self-service petrol stations, as in other countries. Clark says that while some people may argue that this will result in job losses, studies conducted all over the world show that there could be a more pressing and life-saving reason for a change in direction. It is now time for the stock market review, courtesy of the Botswana Stock Exchange.
A very good evening to you all. Let's have a look at last week's capital market figures. We start with the DCI, Domestic Company Index, which was up 0.11% for the week, and the Foreign Company Index, FCI, was up 0.03%. Total turnover for the week was 29.3 million pula, a daily average of 5.9 million pula, and the total number of shares traded for the week was 8.9 million. For the year 2014, the DCI is up 4.04% compared to an increase of 12.5% at this point last year, whilst the Foreign Company Index is up 0.12% compared to a decline of 1.42% at this point last year. If we look at turnover figures, total turnover for 2014 is 1.4 billion pula compared to 1.1 billion pula at this point last year. And the total number of shares traded this year, 385.2 million compared to 369.7 million shares at this point last year. If we look at our exchange traded funds, the Better Beta ETF gained 85 tebe to end the week at 43 pula, and the New Gold ETF lost 45 tebe to end the week at 111 pula 40 tebe. That was your stock market roundup. Thank you very much and enjoy the rest of your evening.
Until next week and another issue of interest, from me, Nameto Sibina, the team behind First Issues, and our sponsors, First National Bank, we wish you a good night and pleasant viewing.